This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, we have a question from Christy. She says, I'm young, 30s, PCOS, high AMH. I've done 2 IVF cycles. First cycle, 5 mature eggs and only 1 fertilized, and ended up an empty sac fresh TF day 3. I'm not sure what TF means. Transferred. Okay. Second cycle, ICSI, 9 eggs, 6 fertilized, and after day 3, only 1 embryo. I did a day 5, transferred, but it didn't stick. I'm scared to go back. I don't know what the issue is.
No, I'd have to look at that. That's the sort of case I get referred quite frequently because I have done so much experience. I'd have to look at the whole picture. We certainly wouldn't be transferring a day 3 embryo, but there's more to it than that. It sounds in terms of PCOS, we should be getting more eggs than what you're getting. So I'd look at the stimulation regime, see whether it's as good as it could be. I would look at the lab. I'd want to know that things were going on in the lab that I could trust, and certainly our own lab is amazing. I'd be more than happy to talk to you specifically about your cycles. Yes, it's not going well. It should do better. Polycystic ovaries, I suppose my other commentary is, did you really need IVF to start with? With polycystic ovaries, I get more patients pregnant using tablets than I do doing IVF on them. So that's the other question I would be asking. I'm a little uncomfortable with some of my colleagues who when a patient turns up and says they're infertile, they say IVF for everything. And that isn't necessarily the case.
My hubby has had a normal sperm test at public clinic. Private clinic, he did a test, said lots of clumping and high levels of sperm agglutination.
Agglutination, yeah.
Does this matter in terms of fertility?
It can do in terms of spontaneous pregnancy. It may inhibit that possibility. But, for instance, using sperm preparation techniques, which is what we use for IVF, it's quite possible if his count is normal that we can actually wash the sperm and do intrauterine insemination and not need to go to IVF.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.